Diet or exercise, which is the key to weight loss success? Recent clinical studies tell us that while both are important, exercise must be included in every weight loss plan. Hey everyone, Dr. Jeff Peng here. I'm going to use recent clinical data to compare the effectiveness of exercise versus calorie restriction. I'll also explain the critical role that exercise plays in achieving your weight loss goals. Plus, I'll provide practical tips for both diet and exercise to ensure a successful start to your weight loss journey. Calorie restriction through dietary modifications is a common approach to weight and fat loss. When you consume fewer calories than your body requires, your body begins to use stored fat as an energy source. This process can eventually lead to a reduction in body weight and body fat. Exercise helps to increase the number of calories your body burns. When you engage in physical activity, your muscles require energy to perform work, and this energy comes from the calories stored in your body. In addition, exercise induces fat loss while also maintaining and even building muscle mass. As you increase muscle through exercise, your body's resting metabolic rate can increase, meaning you burn more calories even when you're not physically active. This can contribute to long-term weight and fat loss. This study is a systematic review and meta-analysis that looked to compare exercise versus calorie restriction on weight loss and fat loss. Head-to-head comparison showed that dietary changes through calorie restriction appeared to be more effective than exercise for weight loss. However, exercise was found to have a superior dose-response effect on reducing fat. The authors write that despite both interventions achieving fat loss via a negative energy balance, there seem to be some inherent differences between exercise and caloric restriction. One theory is that a substantial loss of body weight via diet would also result in a loss of muscle mass, and this would then decrease the basal metabolic rate. A lower metabolic rate would then require a further reduction in calories for weight loss, and this would be self-perpetuating. In contrast, exercise-induced fat loss might be achievable while preserving muscle mass. This is also what we see in other clinical studies. Relying solely on calorie restriction for weight loss comes with a big problem. This study found that after 1 year of calorie restriction-induced weight loss, patients were found to have decreased muscle mass, decreased strength, decreased bone mineral density, and decreased aerobic capacity as measured by VO2 max testing. VO2 max is an important predictor of health because it indicates an individual's cardiovascular fitness, which is linked to a lower risk of heart disease, stroke, and other chronic conditions. Studies suggest that adding exercise to calorie restriction results in greater fat loss as well as significant increases in VO2 max when compared to calorie restriction alone. The other big problem with calorie restriction is that people falsely assume that they don't need to exercise. This study suggests that lack of exercise is a major cause of chronic diseases. Physical activity has been shown to prevent or delay the onset of 35 chronic conditions, ranging from cardiovascular disease, metabolic syndrome, dementia, liver disease, heart disease, osteoarthritis, osteoporosis, cancer, and gastrointestinal diseases. By the way, if you're enjoying this content so far, please do me a favor and click the like button. It will tell YouTube to spread the video to more people and help them too. Thanks for doing that, I really appreciate it. Okay, so I hope it's abundantly clear that any weight loss plan must include both diet and exercise. Taking the combined approach can create a larger calorie deficit, maintain muscle mass, and improve overall metabolic health. The next thing I want to do is go over some tips and tricks on how to start your weight loss journey with regards to both diet and exercise. We'll first start with diet. There are several ways to decrease calories that can be relatively easy to implement. A simple and effective way to reduce calorie intake is by cutting back on high-calorie beverages such as soda, energy drinks, and juice. These drinks can easily contribute a significant amount of calories to your daily intake without you even realizing it. Instead, opt for low-calorie alternatives like water, unsweetened tea, or other low-calorie drinks. Drinking a full glass of water before meals can also help increase feelings of fullness and decrease the amount of food you consume during meals. Another way of increasing satiety, or the feeling of being full, is by increasing your intake of fiber-rich foods. Whole foods such as fruits, vegetables, and whole grains are great options as they contain fiber, vitamins, and minerals that can help you feel satisfied with fewer calories. It's also important to limit processed foods and high-fat foods, as these are often high in calories but low in nutrients. Remember, small changes in the diet and in your eating habits will add up over time and lead to significant weight loss. Now let's shift gears and talk about exercise. The current recommendation for exercise is 150 minutes per week of moderate intensity aerobic activity. Examples of this include brisk walking, cycling, or swimming. You can spread this out over the course of the week, such as going on a 30-minute brisk walk 5 times per week. Keep in mind that this 150 minutes is a minimum. Any additional exercise above this threshold will result in even better health benefits. Everyone should also be doing muscle strengthening activities. These should be done at least twice a week and aim to target all the major muscle groups. And these include the chest, back, shoulders, arms, core, and legs. You can begin with body weight exercises such as push-ups and body weight squats and gradually progress to resistance bands or heavier weights. For older adults, balance training activities are also crucial. These may include exercises such as balancing on one foot or single leg exercises. Yoga is another excellent way to improve both balance and strength. The last thing I want to say is that if you are new to exercise or haven't been active in a while, it's important to start slow and gradually increase your activity level. The most common mistake people make is training too hard or too fast for their current ability. This puts unnecessary pressure on the body, which can be overwhelming and potentially lead to injury. A good starting point could be walking for just 10 minutes a day and gradually increasing the duration to 15, 20, and eventually 30 minutes. As you become more comfortable with cardio, you'll want to start incorporating strengthening exercises into your routine. This 5-minute body weight workout routine can be an excellent starting point for beginners looking for somewhere to start. Check it out next, and thanks for watching.